humans are able to bounce from a fracture really quickly. When we're older, we don't build bones, so having fracture takes time.
The more you smoke, the more you drink, beyond 3 drinks a day, the worse the osteoporosis will be, the worse the bone loss will be.
Black beans and white beans, chickpeas, these are all really rich in calcium.
So if someone has a disease associated with bone loss, such as rheumatoid arthritis or long-standing diabetes which hasn't been controlled, that will have a detrimental effect on the skeleton.
So I get my patients to go down to the marriage proposal position, like this. It's easy to remember. And then come down on their stomachs and then turn over in their back. So you can see how I've kept really nice alignment.
From the Zoomerplex in historic Liberty Village, the Zoomer with Libby Znaimer.
Welcome to the Zoomer. I'm Libby Znaimer. It strikes more women over 50 than heart attack, stroke, and breast cancer combined. But what do you really know about osteoporosis? 1 in 3 Canadian women will break a bone due to osteoporosis, but most of us don't believe we're at risk. And then there's the issue of prevention. Today, we've gathered a panel of experts to look at the causes of bone loss and what you can do to maintain your bone health. But before we dive in, let's tee up the topic.
It's been dubbed the silent thief because bone loss occurs without obvious symptoms. Osteoporosis can strike at any age, but the older you are, the greater your risk. 2 million Canadians are affected, including 1 in 4 women and 1 in 8 men over the age of 50. Osteoporosis fractures represents 80% of all fractures in senior men and women and are more common than a heart attack and breast cancer combined. While it's typical to lose some bone mass as you age, it is not normal to have osteoporosis or to experience painful broken bones. The good news, osteoporosis may be prevented and can be easily diagnosed and treated.
So let's start with the obvious question. What exactly is osteoporosis? Dr. Gorfinkel.
Well, you just take a look at the words osteo and porosis. So osteo means bone, and porosis, just as it would suggest, is porous. And over time, that's what happens to our bones, unfortunately, they become more porous. So for men, that actually starts fairly early and is a gradual and steady loss throughout life, pretty much from the age of 30 through 80 and beyond. But for us as women, we tend to level off up until the time we hit menopause, and then boom, it accelerates and we start losing bone mass at a ferocious pace.
Dr. Khan, why is that?
There are a number of reasons why osteoporosis develops, and it's important to remember that estrogen is the main hormone that regulates bone formation and repair. And so when women become postmenopausal at the average age of 51, estrogen levels go down, and that's associated with a dramatic rise in the rate of bone loss. And the rate of bone formation is not able to keep up with that rate of bone loss.
And Luba, all of this can happen without us really noticing anything, any change to our bodies.
That's right. That's why it's called a silent thief. So when we experience bone loss, we don't realize that it's happening until the outcome that we ultimately want to prevent, until the fracture happens. And we want to make sure that we talk about osteoporosis and we try to mitigate that bone loss before that fracture happens. In addition to fractures, it's silent until some women, for example, start hunching forward because of vertebral fractures. So again, it's really important to get your bone scanned and to make sure that you address that silent thief before you actually have that outcome that you don't want to have.
Okay, so you're supposed to get a bone scan. Now, my understanding is that you have to do this pretty early on as a kind of baseline.
Well, the current recommendations are you start at age 65 to do that, unless there are other risk factors that may predict bone loss. So those risk factors include heavy smoking and alcohol. And what's interesting is that's totally dose dependent. The more you smoke, the more you drink, beyond 3 drinks a day, the worse the osteoporosis will be, the worse the bone loss will be.
But there are ways to prevent it, Bonnie. That's your bailiwick.
Yes, thank you. And actually, the younger that people can address their bone health, the better. Osteoporosis is considered a pediatric disease with geriatric consequences. So the higher the peak bone mass that a person has, then the less likely or the longer it's going to take before them potentially acquiring osteoporosis. And so key factors for exercise for all ages would be weight bearing, like the walking, resistance training to have stronger muscles and bones, and if people are at risk of falling, balance exercises as well. But essentially a full multimodal program for them.
Now, when I think of bones, I think of calcium, and a lot of that is controversial.
Take your 1,200 milligrams of calcium or you take your vitamin D. One of the big concerns there is the harms of calcium. Could there be coronary consequences? Because calcium taken in large concentrations can wind up and do wind up in blood vessels, and it's a major portion of atherosclerosis. And the second issue is for individuals who are at risk of having kidney stones. So where does that calcium go? It winds up being concentrated in the kidney, and it could wind up as a kidney stone.
Do most of us get enough calcium in our diet?
Some people do, because they take supplements in addition to what they already consume, because they think more is better, but more is not necessarily better. And I would agree with Dr. Iris in terms that you can overdo it in terms of supplements, and ideally you do want to get your many nutrients that you need for bone health through diet. And it's not just calcium or vitamin D, there are many different nutrients involved. Vitamin K is really important, magnesium, phosphorus, there's a huge list of foods that are really important for bone health, and that's why it's really important to have a variety in your diet.
When we come back, we'll take a look at that eye-opening survey on osteoporosis. Stay tuned.
Having weak bone doesn't just stop there. It's not just a weak bone. It means that somebody's at increased risk for having a fracture, and that risk is real. It can happen to 1 or 3 women or 1 in 5 men.
Welcome back. A recent study conducted for Amgen asked nearly 6,000 women across 9 countries about their health, lifestyle, and awareness regarding osteoporosis. And while 77% of women aged 65 and up said they were familiar with the disease, many may be overestimating exactly how much they know. Luba, what does that mean?
Well, it, for example, means that in this survey, we learned that about 60% of women thought that it's normal to have weak bones when we age. It's just a normal thing. But around more than half were surprised to learn how common osteoporotic fractures are, that they happen in 1 in 3 women. So it's almost this realization that needs to happen where, you know, having weak bone doesn't just stop there. It's not just a weak bone. It means that somebody's at increased risk for having a fracture, and that risk is real. It can happen to 1 or 3 women or 1 in 5 men.
Dr. Khan, in your practice, at around what age do you start seeing all those fractures?
I can see patients with fractures at all ages because osteoporosis is more common in older people, but it can occur in children as well as young adults also. So I see people of all ages because there are many reasons for osteoporosis, including genetic factors.
Well, one of the interesting things in this survey was that majority, 77%, they said they knew about osteoporosis, but most women said they don't think, 3 out of 4 or something, said they don't think they're at risk.
Absolutely. It's that being distanced by knowing that, you know, bone loss happens, we get weaker as we age, but not realizing that it can have a serious impact on your life. So for example, with a fracture, we found in the survey that 83% of women would be really frustrated if they couldn't do activities of daily living. But that's what fractures do. Even if you have something like a wrist fracture, it makes a difference between you being able to put your clothes on in the morning or needing that help. With my partner's grandmother, she was in her 90s and she ended up with a wrist fracture. Before the wrist fracture, she was at home living living independently. Her daughters could come and visit her, but after that wrist fracture happened, she had to then live with one daughter on the other daughter, and it put a lot of stress on the whole family, right? So fractures are not just fractures. It's not when we're children, children are able to bounce from a fracture really quickly. When we're older, we don't build bones, so having fracture takes time, it impedes on daily lives, and with more serious fractures like hip fracture, there's also increased mortality and morbidity.
Dr. Khan, again, do you find this kind of denial? I was surprised by that, because given that just your age is a big risk factor, and then there are a whole bunch of other ones, which I want to go through in a moment, that people saying, no, I'm not at risk, when I would think actually that means that many people, many women over 65 are in fact at risk.
So if someone has a disease associated with bone loss, such as rheumatoid arthritis or long-standing diabetes, which hasn't been controlled, that will have a detrimental effect on the skeleton. And there are drugs like prednisone. If you're taking prednisone, that's going to cause major harm to the skeleton and can result in a fracture even before the bone density goes down. So being aware, as was mentioned, being aware and taking preventive action to prevent fractures is really important.
Let's go through some of these risk factors. I mean, I was a bit surprised when I read that chemotherapy is a risk factor. I've had 2 big courses of chemotherapy.
Bone is complicated. And how is it complicated? Because it's not just a matter of how much bone is there, it's also the quality of that bone. And so while our scans can measure quantity, we're very poor at measuring quality of bone. And in addition, it does not look at muscle, bulk, power, and tone. And that is huge, because what happens when Libby walks? The muscles are absorbing most of the force. It's not actually going into the joints. It's not going into the bones themselves. A little bit does, and yes, that helps to build muscle, to build the bone. But the fact of the matter is, DEXA scans, the bone scans that we're now doing to measure bone density, do not tell us about those other very important aspects: muscle, bulk, power, and tone.
And so even in terms of the people who are aware that they've had a fracture and they have osteoporosis, sometimes they don't actually think that the fracture was from osteoporosis. They might fall and say, well, anybody would have broken their bone. And so that's another conversation to have as well, because as you were mentioning wrist fractures are considered being a hip fracture telling you it was coming. So therefore, we really have a role for any woman or man who's had a fracture over the age of 50, really to investigate, was that a normal force on an abnormal bone or an abnormal force on a normal bone?
Yeah, to your point, those things happen very often. You come to a person, you try to explain to them that this fracture may have happened because of osteoporosis, and that link isn't there. It's always the answer, I fell really hard, right? And when you mentioned there are other aspects other than how much bone we have, bone mineral density, there are quality aspects. This is why it's important to make sure that we notice that fracture, because that fracture signals future fracture, more serious, and that fracture is able to tell you other things other than bone density tests that maybe you don't have that quality because you've had that fracture, right? So it's important to pay attention.
The 2 single most important predictors for fracture, number 1 is age, and the other is have you had a fracture? And not all fractures are created equally. So if you take Iris Gorfinkel, for example, not that I'm suggesting this, and you drop her from 3 stories, she's gonna break. I guarantee it, she'll break, and probably in more than one place. But leaving that aside, if Iris Gorfinkel slips in her bathroom and fractures her wrist, in other words, I'm falling from a standing height, that's what determines osteoporotic risk. So the true definition of an osteoporotic fracture is not just, did she break? It's what distance did she break from? That's the big determinant.
Okay, what are some of the other risk factors, Dr. Khan?
So there are many risk factors for fracture, and I also wanted to mention that we can also arrange for bone density of the arm, the radial bone density, because the spine can be falsely elevated because of degenerative changes, or if you have a fracture, it crushes the vertebrae, and it can result in a falsely elevated spine assessment. So sometimes you can have a bone density that looks normal, but it is actually abnormal. And arthritis in the hip can also result in a falsely elevated bone density. And so when we evaluate a patient, it's important for us to ask, have there been fragility fractures, which are fractures with falls from standing height at important skeletal sites? And then we do other assessment, and that would include lab tests and evaluating other risk factors. The other risk factors include, we've talked about alcohol, we've talked about smoking, it's steroid therapy we've talked about, and also gait and stability. These are very, very important. So if someone has had falls, this is an important risk factor for fracture.
What about your size? I've read that being a smaller person puts you at risk.
Yes, it's true. It's, you know, having a smaller frame puts somebody at risk, and it's biomechanically, if you think about it, you have smaller bones. You know, smaller bones will fracture with lower forces. But that's not to say that women that are overweight don't have osteoporosis, but definitely smaller frames are one of the risk factors.
Going back to medications as well, there's some that increase your fracture risk, like we were saying, steroids, some cancer medications, even some HIV medications. But some that are very commonplace as well, like medications for heartburn, or those that can increase your risks of falls. So things like sleeping medication or benzodiazepines, those can increase your risk of fractures because you have lower reaction times.
And when patients are prescribed these things, Dr. Khan, do you think they always get the information that this increases the risk of osteoporosis? I've never seen that on a medication.
Yeah, that's very important that patients discuss this with their physician, because medication for depression, for example, SSRIs and SNRIs are drugs that can actually have an impact on the osteoblast's ability to form new bone. And so it is important for patients to discuss the potential side effects of drug therapy with their physician and discuss their impact on fracture risk.
Yeah, and I think that's a role even with pharmacists that they can speak to about the benefits and risks. Like some medications have benefits, and so we want to use them, but we have to mitigate risks. So working to mitigate risk through diet or exercise if it increases your fracture risk.
Okay, when we come back, we'll discuss how your diet can impact your bone health. That's next.
These are collard greens. Many people don't know collard greens, but they're actually really delicious. They're pretty easy to make. You just have to remove the stalk, the hard stalk in the middle, and then fold the leaves and slice them really thinly like you would cabbage for coleslaw, and then you can saute them.
Welcome back. I'm here with Nadine Khoury of NAD Nutrition, and we're going to find out how important our diet is when it comes to bone health, and what are some of the foods that should be at the top of our list. Nadine.
Thank you. So our diet is extremely important when it comes to our bone health, because our diet provides the building blocks for building strong bone cells. So our bones are continuously being renewed and regenerated and remodeled at all ages, and so it's really important to provide the building blocks. And I'm here to show you a few examples of calcium-rich foods, but not only calcium. Calcium is one of the nutrients that's important for bone health, but there are many, many different nutrients involved. So everyone knows that dairy products are rich in bone-building calcium, and it's true. So a cup of milk will give you 1/3 of what you need in a day, a cup of yogurt as well. But if, let's say, you are lactose intolerant, or you are following a plant-based diet and you're trying to reduce your animal protein, you can totally get your calcium from plant-based foods from, for example, milk alternatives like almond milk, and I recommend unsweetened almond milk. You can also get a lot of calcium and different nutrients like protein that's important for bone from cheese. Cheese is great. All you need is 2 tablespoons of Parmesan cheese to get the same amount of calcium in 1 cup of milk.
Yeah, vegans won't eat cheese, though.
That's true.
Yeah.
But vegans can eat legumes like black beans and white beans, chickpeas. These are all really rich in calcium and also really rich in other nutrients like fiber, magnesium, and they're all really helpful to build strong bones.
And these are collard greens.
These are collard greens. Many people don't know collard greens, but they're actually really delicious. They're better cooked, lightly sautéed with a little bit of olive oil, garlic, and chili flakes. And they're pretty easy to make. You just have to remove the stalk, the hard stalk in the middle, and then fold the leaves and slice them really thinly like you would cabbage for coleslaw. And then you can sauté them, and to make it, that could be a great side dish, or you can add some chickpeas or some beans to that dish and cook it down with some broth. Bone broth is great because that's good for our bones as well. That could be a great lunch idea as well.
What about these? Who knew? I mean, sesame and poppy seeds here.
Sesame seeds are really rich in calcium and fiber and different nutrients that are good for bone health. These poppy seeds are great, but these are actually chia seeds.
Oh, sorry.
Chia seeds are amazing because they're high in fiber, essential fatty acids, omega-3 fatty acids, as well as calcium. And all you need is a couple of tablespoons to get what you get in a cup of milk. So that's great for vegans and vegetarians.
And do you get the same nutrients? So for instance, with white beans or chickpeas, if it's all ground up or pureed to make a hummus, is that as good as eating the whole bean?
Absolutely, yes. And it might even be better because if you're adding tahini, like sesame seed
yes.
base, to that chickpea, you're increasing the calcium amount and the nutrient amount of that dish. So absolutely, yeah. At my practice, a lot of my clients ask me how to make overnight oats. And so I just get a mason jar like this. I like this size because you can use the rest of the size of it to add toppings to your overnight oats. It's very easy to make. You just put about half a cup of rolled oats. I like those large flake rolled oats. And I'm just gonna ask you to give me that milk from over here.
Okay, and those are not the instant ones? What?
Those are the large flake rolled oats. They're not the instant ones.
Okay.
And they have more of their, they're less processed, so they have more nutritional value. And so you can make this in advance the night before. And basically half a cup of milk goes in here. I'm just going to ask you to give me the chia seeds right here. Put the chia seeds in there. A teaspoon or a tablespoon to taste, right? I'm going to put a tablespoon because it's maple syrup is good. And as long as you're not diabetic and you're not watching your sugar intake, maple syrup is good. And I put a little bit of vanilla in here. Just a dash, it needs just a quarter of a teaspoon. I like adding vanilla and cinnamon to this because they trick our taste buds into thinking that we're getting something sweet when we're not. So it adds a lot of good flavor. And it actually, I need yogurt for this if you don't mind just giving me that. And we're gonna add some yogurt in here, about a quarter cup. And that's it. So I mix everything. Just gonna use the spoon. You literally mix everything and leave it overnight in your fridge. And then the next day, I have one already made here. Oh. It's ready. And it tastes delicious. All you have to do is add whatever toppings you like. I have blueberries here, but you can add apples or bananas. And then I like to add some almonds to that. And you can sprinkle that, and goji berries. Goji berries are
I was going to ask, what are these?
Goji berries are also very rich in calcium, actually. So just sprinkle that, and you can enjoy this as a great breakfast idea or as a snack.
Well, I look forward to trying that. It looks great. Yeah. Okay. When we come back, we'll discuss keeping fit despite your osteoporosis diagnosis. That's next.
Just sitting or standing or doing something, you just lift your breastbone up to the ceiling. And in that way, your head comes back, your ear goes over your shoulder, and you're in a nice neutral position right here. And you're loading very carefully and safely through your spine.
There is a mountain of literature on the benefits of physical activity, prescribing exercise for our gang may be more important than prescribing medications.
And that's why Moses has launched CARP's new Stand Up Straight and Move Our Buns to Preserve Our Minds campaign. It's all about getting you off your tush and moving, whether it's a casual stroll in the park or if you're breaking a sweat outdoors, it all counts. Here at Snow Valley Ski Resort north of Toronto, we're taking you behind the scenes of a Zoomer Mag photo shoot featuring a 71-year-old with a trailblazing passion for snowmobiling.
We've been riding, my wife and I, for the past 30 years. So we're very fortunate where we live in Sudbury, Ontario. We can ride most of the season right out of our yard.
We'll go out for an afternoon and put on 200 kilometers, stop someplace and have a nice lunch.
Over the years, I've met dozens of Zoomers that have taken exercise to the next level, breaking records and proving that age is just a number. That includes another new addition to the Ultimate Zoomer roster, 52-year-old microbiology professor JP.
I realized that race walking was a very good exercise. It's not as impactful on the joints as the running. I won silver medals in the World Masters Games and bronze medals at the World Masters Athletics Championships.
And if some exercises just seem too difficult, experts say the key is to modify.
So Maxine here, she is doing the modification because she has got a bad knee. So we asked her, instead of jumping, she can tap from side to side. And then instead of crawling underneath the bars, all she could do is just be lifting up one leg, one leg.
My favorite thing is the ropes. I love doing the ropes because I have a lot of arm strength, but not knee strength.
To learn more about this exciting new exercise campaign and find out how you can join the movement, visit carp.ca.
Welcome back. Living with osteoporosis means you're at greater risk of a fracture, but it doesn't mean you should stop being active. In fact, the opposite is true. I'm here with Bonnie O'Hare, physiotherapist, who's going to show us some of the exercises.
Excellent. Thank you, Libby. And just as a start, exercise is so important in the prevention and management of osteoporosis. But there are some guidelines that we have for it as well. And I'm going to be showing you a few things that pretty well are safe for everyone to do. But any exercise program somebody is involved with, it should be individualized, it should be progressive, it shouldn't be causing any pain, and hopefully it should also be fun as well. So we do have some guidelines for what is right and what is risky when it comes to exercise. We have guidelines from Canada, the Too Fit to Fracture. We have guidelines from the UK, Strong, Steady, and Straight. And one of the key things with your exercise program is to make sure that you are having good posture. And I have been watching you while I've been sitting on the panel, Libby, and I did see that your posture is actually quite good.
Okay, thank you.
One of the first things, after I have assessed my patient, and I'm assuming that we have just finished your assessment, and I know what your risk factor is for risk fracture rate is. I know what your health is like, and I also know where your strength and your balance are. And so before I send my patient home, I want to send them some things to do so I know that they will be safe with what they're doing. So what's very important is to have good posture, and we've lived with that all of our lives, being told to have good posture. And oftentimes we get into what is called like a soldier kind of position. But I like to teach my patients something I call a breastbone up. And what we want to do is we want to avoid people being in a flexed position. And the reason for that is
you mean a hunched over?
A hunched over position, flexed, bent position, because that puts too much of a load on the vertebrae or the spinal vertebrae, and that puts them at risk for fracture. So the more we can unload the vertebrae, the less force it's going through the bone on a regular basis. So I teach my patients something called a breastbone up, which is literally if you're just sitting or standing or doing something, you just lift your breastbone up to the ceiling. And in that way, your head comes back, your ear goes over your shoulder, and you're in a nice neutral position right here, and you're loading very carefully and safely through your spine. And for the type A personalities, it doesn't mean doing this with your breastbone up. This is a breastbone up. No, you're perfect. We don't want people arching back. So we want people to practice that through their normal everyday activities. So whether they're sitting or standing or walking, any position they're in, reaching for something, make sure that you go into a breastbone up because you're unloading from the spine. So that's your upper back, but we also want to be careful with our lower back, and that's where there are some key areas where people are at risk for a spinal fracture. And so we want people to avoid any kind of rounding position like this as well, because again, it's putting too much force through that front part of the vertebrae that is at risk for a compression fracture. So what I teach my patients with that is just to make sure that when they're doing everyday activities, whether brushing their teeth or emptying the dishwasher or whatever they're doing, is that they are doing it in a hip bend and not a back bend. So we don't want people to be rounding their spine like this. We need to go forward in life. We have to do things, but we want people to bend at their hips and not round their back. Okay, so let me see how you're doing with that. Okay, come back up straight again. Okay, and sometimes for people who might find it difficult, but you've done that really well, is to put their fingers in front of their hips and then just bend over their hips like that. And up you come again. Good. And sometimes...
I'm not clear on what rounding my back is. Is it like tucking your tailbone? Or?
It's one of the things that I tell my patients right away. I talk to them about what is right, what is risky. Bending over to touch your toes. So if anybody with osteoporosis or low bone density does that, they should stop today. Sit-ups and crunches as well. They should also stop that. And sometimes my patients aren't very happy with me when I tell them that because they want to work their abdominals, but there's many, many other ways of getting a strong stomach. So again, a crunch, a sit-up is a rounding of the spine.
I see.
And a bending over to touch your toes is a rounding of the spine. So therefore, we teach people to bend at their hips.
Okay.
In that way. And I have this thing to check to see how you're doing.
Okay.
Right? Somebody said, don't hit Libby with it.
Okay.
So what I do with my patients, because, you know, we get used to habits and doing things a certain way. So the brain and the muscle have to be retaught some things. So now, Libby, just kind of bend at your hips there while you keep amazing. That's excellent. And up you come. Because if she was poking her head forward, not in good alignment, her head would come up or it would come off her sacrum if she wasn't bending properly. So she's done really, really well with that. So again, if there was one thing that I would just want to recommend to everybody is think about that breastbone up. Give yourself some cues. You're watching TV, every commercial. You're reading a book, every chapter. Sitting, having dinner, do a breastbone up. I call it the doorway exercise. Every time you go through a doorway, think about the breastbone up, all right? So I would also, what's really very important, not everybody who falls fractures, but a lot of fractures will come from a fall. So strong legs are crucial, as is good balance. So if a person can't stand for 10 seconds on one leg, then they're more at risk of a fall. And so therefore, if I had assessed your balance already, and you could stand on one leg for 10 seconds, then I would make that more difficult for you. Because we always have to be progressing exercises. So then I would always have somebody stand close. And as you see, when I've gone down to get that chair, I haven't bent forward. I have actually used my legs and bent at my hips. So I would like you to, Libby, would you like to try this? Stand on one leg.
Okay.
Without holding on, if you can. And now just turn your head to the side. Just to the left and the right. Good. So you can see where Libby's a little bit more challenged there.
It's my bad knee.
Yeah, so you might be okay on one leg, but not the other.
Yes.
So what's important when you're doing a balance exercise is that you feel challenged, but you're still able to keep your good posture, because we don't want anybody getting out of their good posture. That's why good posture is important in your exercise as well as your everyday activities. Okay. So we would want to get people to the right level of balance exercise as well. Okay, would you like to lie down on the floor?
Okay, love to.
Libby, before you do that, can I show you how I would teach my patient to get up and down from the floor? Okay, because often, again, you know, we can't be perfect, but we want people to do the things in best alignment as often as possible. So I get my patients to go down to the marriage proposal position, like this. It's easy to remember. And then come down on their stomachs and then turn over in their back. So you can see how I've kept really nice alignment for that, all right? And to also get back up in the same way. So for people that are getting down on the floor, playing with
that's how I get out of the bathtub. I have a great big bathtub, and that's how I get out of it.
You're doing the right thing. And so, but what's important is those are the start of exercises, and people should always be progressing through a full exercise program. And what's important is that people are doing what they enjoy as well.
Okay. Thanks.
You're welcome.
When we come back, we'll take some questions from the audience. That's next.
What percentage of patients are able to maintain healthy bone density after stopping Prolia injections?
welcome back. It's time for questions from the audience, starting with Kathy. Hi, Kathy.
Hello, Libby. My question is, what percentage of patients are able to maintain healthy bone density after stopping Prolia injections?
So Prolia or denosumab, it's an antibody to the rank ligand signaling protein that activates the cells that cause bone resorption. So when we take this medication, it actually prevents the rate of bone loss from progressing, and it will preserve and protect the skeleton. Now, when we stop this drug, 3 months after stopping, the rate of bone remodeling or bone loss starts to rise within 3 months. And so it's very, very important that patients take the medication consistently and not stop the medication. And 1 year after stopping, your bone density will be back to the baseline value. And so it is important that when we take this medication, it be continued. If you don't want to continue or you're really pleased with how great you've done, you must speak to your doctor before you stop it. Because if you need to stop it, there are ways to take you off the medication, but please do not stop the medication, because otherwise you can lose all the benefit.
And so if you are stopping because there are some reasons where you and your physician have decided that it's not appropriate for you anymore, then that's when alternative therapies would take over rather than stopping entirely. If finances are an issue, then I'd say speak with your pharmacist. We're crafty sometimes, so we can see what options there are, either through government or private insurance, or compassionate programs through drug companies.
Okay. Okay, next we have Eugenia with a question.
Hello. Hello to everyone. My question is about calcium supplements, the difference between chemical calcium supplements and sea-based or plant-based. The claims for the sea-based are astronomical. They're amazing. They're also expensive. And I'm in a position now where I'm seriously looking at, I've got to do everything I can to hold where I'm at or to make it better. And I just want to know, what are your thoughts about the difference between the two? I know that the chemical one, there's the heart issues and kidney stones, and apparently that's not the case with the plant-based.
You're talking about the algae-based calcium sources?
Yes, I am.
Yes. These are new products that are coming out, and they're showing really good results. However, you can get the same effect from getting all the nutrients that you need from your diet if you have enough variety in your diet. Mm-hmm. Are you able to eat calcium-containing foods?
Yes,
Some of those we mentioned today?
Some, I'm eating all of them. All
okay.
Of them. I understand that I should, as well as that, be taking a supplement. I have a malnutrition.
Okay.
Okay, and malabsorption.
I think calcium supplements are okay in small amounts, in small doses, around 300 milligrams per day.
Okay.
But you don't want to take too much.
Thank you.
Write down what you're eating in the day and how much calcium you're getting from there. We want to target about 1,200 milligrams for people over 50, and so it's possible that you're getting that from your diet or even from meal supplement drinks, like things like Ensure, that are calcium fortified. Same thing with vitamin D. So people who are over 50, we also want to get about 1,000 to 2,000 units of vitamin D. So you can see what you might be getting from fish, as well as some of the foods that we highlighted, and then supplement from what you're missing. But you don't want to go too high or too low.
Thank you.
Okay. When we come back, final thoughts.
On Facebook, Stanley writes, I'm a Zoomer, and I am very concerned about bone health. Raising awareness is key, as most people don't even know they have osteoporosis until they've had a fall or a serious break. Everyone should be talking with their doctors to find out ways to prevent bone loss. In another episode of theZoomer, we discuss tech trends. Phyllis writes on Twitter saying, future technology that can and will change the way we work and live is something to look out for. It can lead to new opportunities and new expectations and is much closer than you might think. # new technology. Keep the comments coming in and connect with us on Facebook, Twitter, and via email at rsvp@zoomermedia.ca. Don't forget, for free tickets to the show, go to www.universe.com and search Zoomer Media and log on to www.thezoomertv.com for full episodes and more.
Welcome back to the Zoomer. It's time now for final thoughts, starting to my left.
Thank you, Libby. 2 thoughts. Your sneakers or your slippers? I won't even go further than that. Second thought, where do people fracture on steps? This matters. It's the first step and it's the last step. So when they're getting on, they don't realize the size of the riser, down they go. And also the last step, it's the refrigerator I want, I don't see the last step, down I go. So a cognizance around where I am on the stairs. In my running shoes, that's it.
Your exercise program should be individualized to you. It should include postural exercises, strengthening exercises, balance training, flexibility, and weight bearing. And just a note on the weight bearing, we're often told to go for a walk, which is so very important, but your bones get used to doing the same thing over and over again all the time. So the most important thing is always to be safe, but if you can add some variety into your walking, like walk a little faster, walk a little bit slower, start a different route, your bones will love you for it.
I'd say sit down with your pharmacist to really review your medications and see which ones might be putting you at increased risk of osteoporosis or even of falls. And if you have questions about either side effects or what medications might be accessible for treating osteoporosis, have a discussion as well, and we can find ways to approach side effects if there's anything that you are experiencing.
Dr. Khan?
I would say that if someone has had a fracture with a simple fall from standing height, then that confirms a diagnosis of osteoporosis and places that person at an increased risk of fracture. And we should talk to our doctor about treatments for osteoporosis because we can prevent further fractures. And the next fracture may occur very soon in the next few years. And hip fractures are very detrimental. They're associated with death and disability, and we can prevent those complications. So talk to your doctor.
When it comes to diet, variety is key. When it comes to bone health, you need as much variety as possible. You also need to reduce your intake of highly processed foods, highly refined carbohydrates, sugary foods and salty foods all seep calcium out of the bones. So variety is key, and getting 2 to 3 servings of calcium-rich foods every day. And if you're not spending time outdoors in the sun, at least 15 minutes of unprotected sun exposure, take a vitamin D supplement.
If you're a person over 50 and you have a parent who had a hip fracture, definitely talk to your doctor about getting assessed for osteoporosis. Or if you're a person over 50 and you have a history of fracture that happened during daily activities, talk to your doctor, especially that window of 1 to 2 years after a fracture. You're at particularly increased risk for having another fracture.
Okay, thank you all for being with us. We'll see you soon. It's time to zoom out.